It is among the most basic of human rights. The right of a woman, a man, a family to control their reproductive health choices. The right of young people to decide when they'll become parents, how many children they'll have, and how closely they will be spaced. It is also the right of couples to know how HIV is transmitted between partners and from mother to child, so they can protect their loved ones and themselves. And it is the right of people everywhere to have access to quality reproductive health services, even those who are forgotten by society, including the very young, the very poor, and those who are stigmatized, such as commercial sex workers. For 50 years, these are the rights that Pathfinder International has worked to secure, extend, and defend in poor and developing nations around the globe. As a pioneer in family planning and reproductive health, our programs have helped raise awareness, increase acceptance, and bring services to millions of people in more than 100 countries. We've helped nations achieve important targets, increasing contraceptive use, lowering fertility rates, and saving lives through programs that promote safe pregnancies and deliveries, post-abortion care, and HIV prevention. Equally important, our work has a ripple effect that changes the very fabric of families and communities. All our programs are designed to have an immediate impact, transforming a woman's life by safeguarding her health and giving her new options for education and employment. In turn, this improves her family's well-being across multiple generations. For example, changing entrenched beliefs and behaviors can help families rise out of grinding poverty. We empower communities, too, by showing them a path and sharing with them tools for creating positive, lasting change. Multiplied across millions of families and thousands of cities, towns, and villages, this work contributes to more robust and stable nations, nations that are better able to rise above the challenges of poverty, disease, and environmental threats. Founded in 1957, Pathfinder grew from the work of Clarence Gamble and his remarkable team of field workers. Starting in the 1950s, before modern air travel, these pioneers crisscrossed the globe, helping to establish 30 family planning associations. At a time when contraception was unknown in many cultures and illegal in others, they sought out sympathetic local allies and together helped win acceptance and expand access to family planning, often in just a few years' time. A set of core principles guided those trailblazers and still guides us today. The first is an unshakable belief in a woman's right to control her fertility. This right must be a cornerstone of any effort to improve the health and well-being of individuals, families, and communities. A second principle is our willingness to go where others can't go due to resource limits, security threats, or political pressures. We often work in areas that are remote, hard to reach, or in a conflict zone, and we take risks that others can't afford to take, helping develop much-needed services in the face of controversy or challenging policies that are harmful to those we serve. A third guiding principle is this: rather than provide direct services, we fund the efforts of respected local partners. This approach offers many benefits. Local groups can more easily build rapport and earn the trust of community leaders and clients. This is a crucial step in changing long-held beliefs and harmful practices, such as early marriage and genital cutting. And local groups can often accomplish the same goals more cost-effectively. Furthermore, by strengthening those organizations, we help ensure programs thrive after our own involvement ends. Another core value can be found in our funding approach, which was employed so effectively by Clarence Gamble. We make modest, carefully chosen investments in programs that have far-reaching impact. That impact can be measured by the life-changing services each dollar purchases. For example, in Ethiopia, $240 keeps a girl in school for 1 year, broadening her horizons and opportunities. In Prachar, India, $16.50 covers the cost of reproductive health training that helps teens make responsible behavioral choices. $85 provides training for a skilled birth attendant, an investment that saves lives by increasing the rate of safe deliveries. In Bangladesh, 32 cents buys a month's supply of contraceptive pills, and $1.15 pays for an antenatal visit to a rural clinic, helping to ensure healthy mothers and newborns. These core principles are at work in all our programs, which span 5 broad areas, starting with family planning and reproductive health. Here, our emphasis is on making information and quality services available to very poor communities and remote regions. One current focus is safe motherhood programs, which help reduce deaths and injuries that result from complications during pregnancy and childbirth. In Peru, our support for one such program benefits 500,000 people. Among our 5 areas of focus, we also work extensively with adolescents, whose needs are often ignored. One priority is helping countries make their existing reproductive health services more youth-friendly. In Mozambique, for example, a program called Geração Bis, or Busy Generation, reaches 1 million young people each year. Our support for abortion-related services is well known. To reduce deaths and injuries caused by unsafe abortions, we help create post-abortion care services, and increasingly we work with governments to expand safe abortion services. A 4th priority is HIV prevention programs that have wide impact. For instance, we work with teens whose whole future may be at risk, and commercial sex workers who are vulnerable to infection and also have the potential to infect many others. Last but not least, through advocacy we seek to influence laws and policies that affect the people we serve. From long experience, we know our work has a lasting impact, but there's so much more to be done. Today, 3.5 billion people, half the world's population, are in or entering their reproductive years. More than ever, they need information and services to help them make wise choices about their reproductive health, to help them find the path to a better future. And every day in 25 countries, Pathfinder will be there, supporting this most basic of human rights.